Hello and welcome everyone to today's very special webinar around supporting fathers and fathers-to-be with some insights from research and practice. My name is Sean Martin. I'm the program lead of the 10 to Men study here at the Australian Institute of Family Studies, or AIFs. Before we begin, I'd just like to acknowledge the traditional owners of the lands that I'm joining you from today. The Kaurna people. I pay my respects to their elders, both past, present and emerging, as well as acknowledging any Aboriginal and Torres Strait Islander colleagues who might be joining us today, and invite you to do the same wherever you're joining us from today. So before we begin the broadcast of the Fathering Symposium, I just have a couple of little housekeeping moments to cover. Firstly, to note that today we'll be having a live question and answer session at the end of the symposium, and I can invite you to submit any questions that you might have via the question portal on the little GoToWebinar dashboard there. The second point is just to acknowledge this is a slightly longer webinar than our usual webinars. It's going to go about for an hour and a half rather than the usual hour. But if you can't stay with us during the whole duration, don't worry. The webinar and the Q&A session will be posted online on the AIFs website by the end of the week. Another point is just to note that we have prepared some related readings and materials for you today. That's again under the handout section in your GoToWebinar dashboard. So I'd invite you to spend some time perusing those. Also, of course, as normal, there's a short feedback survey that will follow the conclusion of today's webinar, and I'd ask you to spend some time. We're really interested in your feedback on that. Also, too, we've been very blessed to have a tremendous amount of input on questions through the registration process. I thank you for those. We did identify some topics that will probably be the out of scope for today's webinar. That's largely or primarily just because we want to spend the appropriate amount of time unpacking all the issues that relate to those particular areas. So they're things like fathers' use of violence, those men who have experiences through the family law system. We here at AIFs acknowledge that they're tremendously important issues for a lot of you. And as I say, we'll hopefully have an opportunity to address those in webinars to come. So let's get going. And I want to first of all start by thanking all of you for joining us today. And as I've said before, your contributions to date as we lead into Father's Day this Sunday. So happy Father's Day to all the dads out there and the dad type figures. It's a wonderful day. For myself with young children, I'm looking to replenish my store of pens and socks. But wherever you are, I hope you have a chance to celebrate that or not this week. So obviously, as many of you know better than most, the nature and the role of fathers in Australian society continues to evolve. And we wanted to take the opportunity today to explore some of these issues and how to best support fathers' health and well-being, and by extension that of their children and their communities. So we're going to start today with a broadcast of the presentations that occurred during the Father Symposium from the AIFs conference back in June. Then I'll be back, and the presenters will be joining us for a 30-minute live question and answer session. Those presenters' full bios can be found in the handout section for the GoToWebinar dashboard, but I will let you know that we're hearing today from Vincent Mancini from the Telephone Kids, Tim Moss from Healthy Male, Harley Hall from Emerging Minds, and our own Melissa Willoughby from AIFs. So let's get started with that broadcast, and I'll see you back here in precisely 57 minutes.
Today, I suppose I have three objectives, and in many ways I might be preaching to the converted, but there might be some skeptics in the room. So the question that I want to address is, how do fathers impact early child development? Like, why do we care about dads in this space of early child development? You hear, oh, well, we can't really do much until they can kind of kick the footy or talk back. So what's the point of me being involved pre-conception, let alone in those early years? I'll talk a little bit about contemporary Australian fatherhood, so being a dad in 2024. And then also, probably of most relevance to many of the people here in the room is engaging fathers in early child services here in Australia. Now I'm going to start with a quote and a couple of photos that might give away who the baby is in that picture about 31 years ago. The contemporary view of fathers is that they have important influences on their children's development, beginning before birth and continuing over the life course. I think it's really relevant for me to acknowledge that I've had a real privilege of having an engaged and responsible father, and I'm the child of 2 immigrants who really value family above everything else. So, shout out to my old man here. So that first question of how do fathers impact early child development? And for me, I never set out as a person who was really interested in working with fathers, actually. I was a child health clinician. I was a clinical psychologist by trade, really passionate about working with young people. And then, perhaps naively, I didn't realise just how much work I would be doing with parents. I thought I was going to be the person to change the lives of these kids. How silly of me to assume that. It's the parents, it's the system that surrounds the child. And through my research journey, what I found is that a constant gap that I was seeing in the literature, and I myself was guilty of this, is in that limitation section, in the end of a discussion section, you say something like, this study was all, we recruited mums. We don't really know about dads in this picture. We don't know if they're relevant. We don't know how they're similar or different. That's someone else's problem. Future research can deal with that. And then, coming full circle, I became the person who's tasked with trying to resolve that. Perhaps an easier answer to that question of what areas of a child's development do fathers impact, it's probably best answered with, well, what areas don't they impact? There's a huge amount of research that's coming out in the field, which is looking at virtually all aspects of child development in the family system are influenced in some way, be it directly or indirectly, by father involvement. This includes things like children's physical health, a lot of work in language acquisition of young kids, infant mental health, neurodevelopment, their capacity for lifelong learning, capacity for lifelong resilience, things like sleep and the ability to regulate their emotions. So just about every dimension of a child's development is in some way impacted by their fathers. There is some overlap between that impact with other parents, mothers as well. But there are, in many areas, some evidence to suggest fathers may exert unique or complementary influences on the development of their kids. And so this really begs the question of why and how. Okay, so we know that there are these associations, we know that there are these relationships. And for me, when I think about framing my research, some of the most significant development to happen in the fathering literature has been the development of good theory and good framework that can actually guide directions for research, as well as directions for policy, directions for intervention, directions for action. The sort of classic biopsychosocial approach to understanding human development has identified across both biological, psychological and social determinants, fathers have an impact in all of these ways. For me, as someone who doesn't have a biology background, I'm really interested in the biological stuff, knowing about things like preconception health of men and how that impacts the development of their kids. Someone sent me a study that was just published earlier this year looking at how fathers' gut microbiome in preterm sort of preconception health, how that has links to children's development. So all of a sudden there's this really fascinating research about the contribution that fathers make before the baby is conceived. Perhaps we know more around how the psychological component as well as the social component as well. When we're talking about the quality of early attachment relationships between that secure parenting system that's around the child, as well as the social determinant. So for example, a lot of people are familiar with this concept of rough and tumble play that dads tend to do quite a lot of with their kids, and how that's actually beneficial not just for human development but across mammals as well. If you actually look in rodent studies, the benefits of rough and tumble play on the long-term development of these mice, and that includes things like social cohesion in their little mouse community, as well as even things like reproductive success. Another framework that people may be familiar with, or I would encourage you to have a look at, is the ecological model of father involvement. Really what this does is it just acknowledges that it's not just the dad and the kid. okay? It's not happening in isolation. There are systems, there are mechanisms that surround that dyad. There's often another partner, there's other children, there's a work situation, there's cultural beliefs, there's chronological beliefs. We're here in 2024, what it means to be a father may differ radically from 1924. And so there are all these mechanisms that link the dad to their child. And so again, this helps us to identify potential pathways that we may need to consider. The other thing to keep in mind as well is possibly complex dimensions of paternal involvement. So again, when we think about what it means to be an involved father, an involved parent, people probably see themselves visualising, you know, dad and kid, you know, doing dizzy wizzies, kicking the ball together, reading together. But paternal involvement and parental involvement is a lot more complicated than that. And parents in the room would probably acknowledge that there are lots of ways that you may be involved, and not all of them are recognised as effectively. And so Plex dimensions effectively derive 5 different types of paternal involvement. And you've got positive engagement activities, warmth and responsiveness, which is probably the one we think the most when we think about an involved parent. We talk about control, process, responsibility, and indirect care. Now, all of these things are important for children's development. So when we think about contemporary Australian fatherhood, this is my mum and my dad and I know that it's nice here, but this was probably not long before they separated and remained separated throughout my life. So it's probably one of the few happy family photos that I have, so I cherish this one quite dearly. So times have changed probably since 1992, and having Lynn present earlier this morning really also solidifies that things are changing. So what we're seeing is, there are growths in the rate of father involvement that we've seen across Western industrialised nations, but they've also stabilised since about 2012. So there was some, sharp increases from the 80s into the 90s and prior to that. But since about the mid-2000s, we've sort of petered out on the amount of time that fathers are spending with their kids. We know that in Australia that we don't just have traditional nuclear families, we have all sorts of blended families, step families, reunified families. And they may have, unique needs as well. And again, there's a growing need to understand fathers in the systems that they exist in as well. So for us, thinking about, what is it about the system? It's the family unit. It's the resources that they have available to them. Just some quick fun. This is my nephew on the left and my niece on the right. It's my brother-in-law. So we know that 1 in every 5 Australians are a biological father. Many more people may play the role of a father figure. Okay, so you might be the responsible uncle, stepdad, so on. We know that since about the 90s, the amount of time that fathers spend with their kids have increased by about 30%. We're seeing greater overlap in parenting roles and responsibilities, but as we know from today's keynote, it's not completely equitable yet. When we ask fathers, and this was work that we did last year, what are the biggest challenges for you as a father here in 2024, 2023 at the time? It was navigating work-family balance. The benefit that they saw was that seeing their children grow and watching their children flourish was probably the most rewarding thing for them as a parent. That was the biggest benefit they saw. And we also know that the uptake of paid parental leave in fathers here in Australia is quite low, remains quite low, and there are lots of individual and systemic reasons for that. What I might do is, this graph here just shows the change in fathers making use of flexible working arrangements to accommodate their children, and how that's changed since the mid-90s to sort of just pre-2020. I'm curious to see what the updated figure looks like in a post-COVID world. But the other thing is here is when we look at fathers' time use up to and after the birth of their first child, you see that they sort of consistently remain employed. That's that fairly horizontal line in the top left there. Whereas things change more radically for mothers. We may expect that as well, given what we heard this morning and given what we know about, men's use of parental leave and many other factors. And so this piece here around enhancing father engagement in parenting programs. So I just want to talk about this briefly before I finish. Increased rates of father involvement in the early years, we know that it's increasing, However, it's outpaced father engagement in parenting programs, okay? So for really common, popular Australian parenting programs, for example, Triple P, many people familiar with Triple P, the ratio of mums participating to dads is about 4 to 1. And again, you'll hear this time and time again from service providers. How do we engage dads? We tried, it was hard, we stopped, or we don't have the resources to, we'd really like to. And so this is a persistent challenge that we hear from service providers. And what we also know actually is with programs like Triple P, these programs, whilst effective for both mothers and fathers, they're less effective for fathers. So even though they get something out of it, they get slightly less. And so that's talking to, what is it about these programs that aren't completely meeting the needs of fathers? We sort of know a little bit less about where and how Australian fathers receive parenting support. We often hear in the qualitative literature that their partner is a real trendsetter in terms of helping them adjust to fatherhood, learning what their roles and their responsibilities are. But there are other informal sources of support and also other formal sources of support as well. So one successful model that's been shown to promote father engagement has been, I guess, the onset of these father-focused service providers. So, we have the Fathering Project here in the room today as one really prominent example, as well as father-focused branches of existing parenting services. And again, we've got some other people here in the room and also across the conference who will also be talking about, their fathers program. What this does is it provides opportunity for tailored content and it removes barriers to participation. One of the classic things you'll hear from dads is they'll say, I didn't know that I was allowed to attend. Or, I thought it was going to be all mums, so I didn't want to come along. And then all the dads think it's all going to be all mums, and then none of the dads comes. A bit of a paradox, right? In a study that I published last year, we looked at how fathers are actually using online social media to receive support for parenting. And the 3 C's that came out of that was connection, community, and convenience. It's like, this is why fathers were using social media to connect with other fathers. And I'm happy to, maybe in question time, if someone wants to ask a question, what you find, share a little bit about that. But then also an Australian study from 4 years ago interrogated this a little more closely, looked to the research and looked at what evidence-based strategies can a service provider, can a researcher use to enhance father involvement. And so these are the 6 strategies that they came up with, right? So the first is to engage fathers as part of the parenting team. Avoid a deficit model of fathering. Increase awareness of parenting interventions for fathers. You'll be surprised how many fathers don't know that there aren't resources that are made for them. Ensure father-inclusive content and delivery of parenting interventions. Increase father engagement practices at both organisational and service levels. And increase professional training regarding father engagement. So this here serves as a bit of a model for us going forward. Just thinking about, an example back home in Western Australia is, for me, I kind of use this joke that, in policies and services, we need to use the F word, okay? We need to actually say that we want fathers to participate, or we need fathers to participate. I don't think that we should feel guilty about that. And in our perinatal infant mental health model of care, you'll actually see specific references made to fathers. So this effectively says there is policy, or there are at least points in policy that are for you. We need your input, and you're important in this early tapestry of child health. So just to wrap up, it's very difficult for us to understand comprehensively the tapestry of early child development without trying to see where fathers fit. They make important and unique contributions to the growth and development of their children, and this does last across a lifetime. I think for me, it's a womb-to-tomb approach to understanding the influence of fathers on their kids. Landscape is changing. We want to understand fathers in the systems that they're a part of, not separate to them, and that there are also clear and actionable strategies that we can use to enhance father involvement. But this is also contingent on an agreement that father involvement is actually something we want as well. Okay, so researchers, services, policymakers, we probably actually need to have some consensus there and say, do we actually value father input? Is it something that is that juice worth the squeeze, so to speak? Or is it too hard and we put it in a too hard basket?
Healthy Male has been around for 23 years. We were established as an organisation called Andrology Australia. We changed our name 5 years ago because nobody knows what andrology is. We are a not-for-profit organisation funded by the Commonwealth Government Department of Health and Ageing, and we provide evidence-based information, education and advocacy to promote the health of Australian boys and men. I will give you a website at the end that you can have a look at if you're interested. Healthy Male was part of a group of organisations that was responsible for writing the National Men's Health Strategy at the end of the last decade. And it identifies 5 priority male health issues for Australia. Priority male health. Mental health, chronic conditions, sexual and reproductive health, and this other one, where men are overrepresented, which is really interesting one, and I'll pick up on. Injuries and risk-taking and healthy ageing. Now, what's not here is fathering. We've got sexual and reproductive health, but we tend to think about that as stopping with fertility. It doesn't involve the father in the antenatal events and the postnatal care of the child. And that's dumb, frankly, because most Australian men want to be fathers, right? Even kids the age of my 15-year-old son, some of those boys are talking about when they're going to be dads. And if you ask a bunch of people in their childbearing years, just about all of them will tell you that they want to be fathers. And it's important for us to consider that in the context of men's health, because men are, I think, wrongly blamed for disengagement with the health services and therefore blamed for poor health. We have a responsibility to look after people, and I think in helping men to be healthier, we can help, as Vincent's shown us to some point, have benefits for their families as well. So it was this that led Healthy Male to come up with this thing that they've called that we've called Plus Paternal. And it focuses on the systems that exist at the moment for father support and identifies where they are lacking and starts to suggest how things could be better. And you know, Vincent's shown us that. The evidence and the feedback from that process show clear and consistent themes. Australian fathers have unmet needs, they're diverse, there are traditional norms, social norms that negatively influence the roles of fathers and the support and experiences they have. And that happens for men and women. The health system's focus on mothers is rightly placed because of the biological role that she serves. But it tends to squeeze dads out. We need to think about, rather than a maternal focus, perhaps a family focus. And the knowledge of men and health professionals in relation to fatherhood need to be strengthened. That's a positive way of saying that men don't know enough and neither do health professionals. So we need to educate them. These are the things that we know influence fathers' engagement in antenatal care. So when we're talking about antenatal, we're talking about up to the time of birth. It's important to draw these lines. The beginning of antenatal is somewhat grey. It's kind of any time before birth, probably after conception. Fathers will be better engaged if they feel that they have a valued role in decision making during pregnancy, and if they feel welcome. They're pretty easy things to accommodate. There's a bunch of things that work against them though. There's the feeling of being excluded. There's a lack of knowledge and understanding that I mentioned. They feel like they are observers, not participants in antenatal. They're anxious because they're doing something that they've not done before, and blokes hate doing that and looking like a donkey. Is another limitation as well. we know that people who are in full-time employment may not be able to spend 3 or 4 hours in an antenatal clinic. And it's a shame that all of these barriers exist, because father's antenatal engagement has lots of benefits for the pregnancy. If a father is involved during pregnancy, then there's a higher likelihood that his partner will have early antenatal care, and early antenatal care is a really good predictor of successful pregnancy outcomes. And father's involvement also encourages maternal healthy behaviour. There's evidence, for example, that if a father is more involved during the pregnancy, his partner is less likely to smoke. There's a lower likelihood of maternal stress and smoking, drug use, alcohol use. And there's good pregnancy outcomes that benefit the baby. So fetal growth restriction and preterm birth, which frankly kill babies, are much less likely if the father is involved. It's pretty cool. And then it benefits the children as well, and Vincent's told us a bit about this. There's a higher likelihood and a longer duration of breastfeeding if the father's involved, and we know that's critical for optimal development of babies. There's a higher likelihood that that dad will be involved in his children's childhood, and Vincent's told us about all the benefit in that, and the benefits to learning outcomes as well. So we've produced this document called The Case for Change, and it has a number of goals articulated in it. I would encourage you to go to the Healthy Male website and grab a copy of this and have a look at it if you're interested. It's all kind of obvious, but it needs to be said. Father's antenatal engagement, though, is not enough, right? Because we know that things delivered during pregnancy don't get the best possible outcome. It's this middle sentence here, or the second sentence here, that's important. Optimising the health of women and their partners prior to pregnancy improves conception rates, pregnancy outcomes, child health, health of future generations. And that's where we think improving the health of men and engagement of men in their building their families can cause benefits. So we're focused now on preconception care. The World Health Organization defines that as the provision of care, unfortunately it says here, to women and couples. It doesn't say women and men. And that is a barrier to men's involvement in these sorts of things, as Vincent suggested. And that care is aimed at optimising the health of parents so that when they conceive and have their babies, they are as healthy as possible. The World Health Organization suggests that preconception health starts sometime in between school and adolescence and adulthood. In a medical care context, preconception care is usually defined in terms of pregnancy, so therefore directed at females, and it's usually 3 months before pregnancy, because you need to be fully vaccinated. For optimal outcomes for your pregnancy, you should be fully vaccinated 3 months before you conceive, and then within that 3-month window is the time that you should start taking your folate and perhaps like that. The Royal Australian College of GPs provide us with the map for preventive care, and this is where they talk about preconception care, and they say a lot about the preconception care of females. This is what they say about the preconception healthcare for males. We have engaged with them, we have written a chapter for them, but I don't think it's going to be in the next edition because there's not randomised controlled trial level based evidence for this stuff. So they're not going to include it in there. That's ridiculous. These are all the things that we can link that concern paternal preconception factors and the outcomes for their offspring. This is a big list of stuff where you can get benefits for babies from caring for dads. And of course you get benefits for dads as well, right? It's not just about improving the health of families that we should be so concerned. Two parts to this slide. I quite like this slide. I've seen people smiling because this image is hilarious. I used an AI image generator to give me a picture of an Australian man in his 30s, and then to have characteristics that are associated with the disease burden in Australian men that's shown in the graph on the right. Australian men suffer as a consequence of alcohol use, illicit drug use, child abuse and neglect, occupational exposure and hazards, and of being overweight. So this is your 30-year-old Australian man. And Australian men are about 33 when they have kids, right? So we've got blokes that might look like this, that have everything beginning way behind the 8 ball. I particularly like that the AI image generator put a cigarette in his hand, so it looks like he's putting a cigarette in his ear. Don't trust AI. And you can see in that graph on the right that I mentioned that there is a larger burden of disease for males of reproductive age than there is for females. This is consistent across the life course. It's about 20% higher in males than females. It's a problem and it should be dealt with. And I finish by referencing an article that you can see cited in the bottom right of this slide. Men are more than just their healthy sperm, and that's often how they are thought of when it comes to parenthood. It's how we think about fertility care for men, for example. There are lots of things that we can benefit from if we think about men, not just as that, but we need more work, and that's where you people come in. We need evidence from epidemiology, we need mechanistic studies to tell us how these associations actually work. We need studies of social determinants. These associations actually need more lived experience, because a lot of the information that we have comes from studies of mothers, not fathers. We know everything about men's use of condoms in Australia from asking women. Nobody's asked me. And we also need investigations into implementation and working out what's causing these barriers that we see, and assessment of policy. And that's where you guys come in, not me. It's Men's Health Week. I want to wish you all a very happy Men's Health Week, and I thank you for your attention.
So these resources, so I'm doing some resources for actually working in family violence, and we developed a documentary and went out and spoke to families all across the country, Darwin, Western Australia, to make this documentary. One of the things that came out of this, these conversations with mothers and practitioners, Aboriginal practitioners and researchers, was our men are portrayed in such a way that the only time that they talk about them is with family violence. And that is not our community. Yes, we do have community that are struggling and that are suffering and that are hurting, but that's not our community. When are people going to talk about our men in ways that are actually positive? So, so these resources came out of that, because it's like, well, yeah, it is true. There's this assumed way of thinking about Aboriginal fathers. So excluding from services, yeah, definitely just as a man, but then be an Aboriginal or Torres Strait Islander father. And that brings on a whole new level of exclusion. So these resources came out of these conversations. So I just want to share, this is one of the videos that are part of the documentary, and then we'll talk a little bit.
Could you represent
represents for me strength and protection. As a dad, sharing that knowledge and passing it on, teaching my son how to do this, and then that's something that he's proud, you know. Not so far, a bit more inside, right? Culture's a big part of our living, and it's something that, you know, no matter what we go through in life, it's something that I hold on strong, no matter what we go through or who we face in life. And that's something that no one can ever take away, so they can sort of, you know, take physical parts and stuff like that, but your strength and culture and identity inside, that's something that no one can ever take away from you. For me, protection is family. So being around my family, because I'm going through a tough time, and I think just being open, being able to talk about things, not hold it in. And just being around family is what helps me get through. But also, like, being with my kids, you know, being able to see them, that's protection and strength there. My name is Harley. My Nunjiri name is Rakni, which means sharp in the Nunjiri language. I'm a proud Nunjiri Gula man from Rauken and Kunamai. I'm from Tajuna, west side. I've got 2 daughters and 1 son. Yeah, I live on country down in Murray Bridge. I'm Nunjiri Rui. My kids, they've got big hearts, different personalities. They're my world, you know, they hold me together. So everything that I do is for them. That's why I live a positive life and stuff. Because I want to be known as a positive person in community, and it's all for them. So everything that I do is to teach them to be strong, proud, Nunjiri little kids too. Be proud of their culture and their identity, be there for each other, be loving and caring for each other. They're very loving and caring, even though they can fight like siblings do. Me as a father, I want to be able to provide for my kids and my family, remain strong. And it's hard when you're out there fighting for your rights and fighting to be heard and that sort of stuff, and just to be treated normal. Yeah, and then come back and be strong for your family. So I guess having the world stereotype us, and yeah, it's hard. The stereotype out there in the real world doesn't give us a voice and doesn't value us as much as it should. I think the role of a man in a family is just as much, you know, as a mum's roles. And out in the real world, of being part of the system, you know, my own experiences and stuff, I've known that I've never been valued as much going through the system, and some of the stuff that I've faced. If I have to go through that, I can imagine everyone else having to do that too. The river's a big part of me. I grew up on the river and very connected to the river, and it's part of our healing too. So the river's always a big part of strength for me. So if I'm having a bad day coming home from work, I'll go the long way just like to go see the river. You want to be the best that you can be, and you can only work with the cards that you get dealt with. And a lot of the things that we go through, like generational trauma and the past, you know, is something that's out of our hands, but it definitely affects all us families in different ways. So I think of like our elders and ancestors not being able to speak their native tongue and that sort of stuff, and being dispossessed and having them everything, the world against them sort of thing, and then fighting through, trying to be strong, going back for their families, you know, and you know, you've got to swap the society, you know, the system breaks them, and then they've got to go back to their families and try and be strong. I want them to be able to come to me no matter what they're facing. I didn't feel like I could go to my dad and talk about my feelings and emotions. So for me, that's probably big. So also providing and stuff for them, just be there for them. Really, I think that's the most important thing for me, is being there for my children.
conversations. I'm actually really, being a non-Aboriginal woman, it was a really, going around and having these conversations with dads was really, you know, like, for myself, really hard. And that was the hardest part, was actually my own fear of having the conversation that actually, you know, that stopped it. So I just went out and talked. I just went out and talked to dads and I said, look, you know, we're doing this, do you want to be involved? And men want to talk. They want to talk about their children. Like, think about that. You know, amazing. Harley, do you want to talk about that old fella, that John, that we had the conversation with in Darwin?
Yeah, so one of the men up there, I'd say, you know, for me, like, he's the strongest man I ever come across, you know, like, and he was only small, not you know, physically strong, but just, you know, because he was a man that lived in two worlds, and he talked about living, you know, traditionally, providing for family, to now having to go work and earn money and to provide for family. So, and yeah, he's just definitely one of the strongest men. Like, I'll never forget him. And you know, he is good. You know, he talked about like our new spear being money to, you know, provide for family, because, you know, traditionally, you know, he still goes back and forth, you know, but we live in a world where we have to provide for our family, and in the Western world, it's money. We need to, you know, put a roof over our head and food and that sort of stuff. But yeah, you know, I think he went through everything. I noticed with a lot of the men that we went and talked to, there was, you know, similar. Like, they all said similar things, you know, like about, you know, not being heard, that sort of stuff, and you could tell just from them being, you know, with their families and stuff, like, you could tell that they were family men, strong, proud family men. But I guess, you know, sort of feeling like they were held down a little bit by the system and reality, you know. So yeah, it's definitely, you know, an eye-opener. I was sitting there listening to him, and I just cried, you know, I could just relate to him. And, you know, he's, to this day, like I say, like, he's the strongest man that I've ever come across, you know. Just listening to his story and you know, how he's still being a strong man, providing for his family, but yeah, living in the two worlds. So, and I could relate to that. So, yeah.
And that conversation was a really great example of how to have a conversation. This was a traditional man. He was he'd gone through ceremony. There's law. There's rules around talking. As I'm hearing his story and he's talking to me, I'm going, oh, should I be hearing this? Should I be hearing this? And I said, do you want me to leave? Is this something that I should be recording? Is this something I should be hearing? And he goes, no, I want you to hear it. I want you to hear this, and I want you to share this story. I then had to turn around to Harley and go, can you stop crying? It's coming through the mic. No. It was really great. But it's just having those conversations, I'm not an expert at being a father. I do have 6 brothers, and they tell me that I'm a little bit of a boy sometimes, but I'm not that father, and I'm not that expert. And I think that that's one of the things around that we can learn in our practice, be it whether you're working with mothers or children, being the non-expert and being able to be curious and to be able to ask conversations. People want to talk, and I was really surprised at how much the Aboriginal men shared with me, to be able to share with you. So Harley's story is one story of many that we get to listen to. One of the other things that really surprised me as well was I worked with Darwin's Indigenous men's group up there, and I walked in and I was talking about our resources, and they said, we know your resources, we use them within our men's groups. And I was like, oh, you know, like how amazing is it to hear stories of how dads are trying to actually, you know, consider different ways of being with their children. So it was really quite amazing. The other thing that we really need to consider around Aboriginal and Torres Strait Islander parenting and roles of fathers, and that might be different from what you might be thinking about from a non-Aboriginal perspective, is that dads have a really, really central role in being responsible for passing on culture.
Yeah, so I was lucky enough to be, you know, grew up around culture and my dad being stronger in culture and that sort of stuff. And you know, if we talk about being resilient and growing up, you know, that's the, you know, it's one of the main things that helped me get through my toughest times in life. And you know, and for me to be able to pass on and share that culture with my son, you know, or my children, you know, it's something that's going to keep them strong, and there's something that can't be taken away from them either. So, you know, it's really big with my family. I guess, you know, if we're going to be real, I was sort of getting into trouble with the law and that sort of stuff, and I didn't start, you know, thinking about what sort of person I wanted to be until my oldest was born, you know. Then that's when I started thinking I want to be like a role model. Yeah, and literally changed my life and my everyday way I think, you know, and being positive. So from there, I guess I you know, went out in the community and you know, for the last, you know, 15 years, I've been really highly connected with the community. And but even with, you know, being connected and strong, and you know, I find it real hard because, like, you know, I'm going through some stuff now still, you know, fighting for my kids in court and that sort of stuff, and I feel like I don't have a voice. And I know that we're all born with, you know, different temperament, resilience and that sort of stuff. And I see myself as really strong and resilient. And you know, if I can only imagine people that aren't so strong and having to go through that, you know. So I guess I'm lucky to be born with, you know, strong temperament and resilience. And but yeah, I think, you know, talking with dads and I guess, yeah, helping and that sort of stuff is only going to build on that. But you know, culture was a big part of my upbringing that helped me get through that, and that's something that I share, and cultural practice in community and that and stuff, and just to build, you know, around that strength-based, resilient sort of work with youth and adults. So.
I know we're actually running out of time, but I just this is a plea or a call to action. Be it whether you're in a taxi and there's a man there and you might just go, are you a dad? Do you have children? What's that like? Or when you're working with a family, you know, include that father. But particularly when you're working with Aboriginal and Torres Strait Islander families, don't let ideas and assumptions actually cloud what's real.
So some background on this topic. Ben did a really good job of providing a really good overview of this area. Just to reiterate a few things, we know that both mothers and fathers play a really key role in the health and development of their children. Almost every child in Australia will have a biological or non-biological father figure, and mothers are still disproportionately responsible for much of the household and childcare duties. However, fathers are increasingly taking on more childcare duties than they have in previous generations. Fathers are also no longer thought of as only a breadwinner, and now take on more hands-on duties like feeding and caring and looking after their child. And this shift in fathers' behaviour and their childcare now provides a new opportunity to support child health and wellbeing. Improving child mental health can be done through supporting fathers to work out what are the best things they can do for their kids, and this will benefit not only fathers and their children but also mothers and families. So in this context, we wanted to look at the evidence to understand what fathering practices can be done to promote child mental health, and how can child and family practitioners support fathers to promote child mental health. I'm not going to spend too much time on methods, but I am a big methods nerd and would like any questions, or if anyone would like to have a chat afterwards, very happy to. So just very quickly, we conducted a rapid evidence review, and this is a type of literature review that has systematic and replicable methods that is done in a tight and concise time frame, and it can be completed relatively quickly compared to other types of reviews like a systematic review. So the first step that we did was consulted with stakeholders, and these stakeholders were experts in fathering and parenting, as well as men's and child health. These consultations informed our research questions, the scope of the review, and any publications from the review. This is our inclusion criteria. We were interested in research studies that looked at the association between fathering behaviours and child mental health. We restricted our review to high-income countries where English was the primary language, and they were published between 2012 and 2022. And we put in these restrictions to make sure that the evidence that we were reviewing was based on contemporary evidence and was also the most relevant to the Australian practice context. So the studies that we have found, we analysed them using a narrative synthesis, and we also guided our analysis around the 5 paternal engagement elements listed here, and Vin very helpfully has already gone through all of these. I'll touch on their definitions again when we look at the results. So our search returned about 5,500 records, and of these, 32 met our inclusion criteria that I showed in the previous slide. Most frequently, the studies were cohort studies, and they were conducted in the USA, UK, and Australia. These studies often use data from large longitudinal surveys, such as LSAC, the Growing Up in Australia study, the Fragile Families and Child Wellbeing studies from the USA, and the UK Millennium Cohort study. So there was a wide range of fathers included in the studies, from 0 all the way up to almost 10,000. On the higher end, these were usually where people had conducted their own type of review and had concluded multiple studies. And as Vin noted in his presentation, some of the studies didn't actually ask fathers at all. They interviewed mothers and children about fathers' behaviour, and we found 3 studies that met our inclusion criteria that did this. Where the studies did report on the father's characteristics, they were usually biologically related to the child. There was a mix of married or unmarried, and the fathers usually lived with the child and were predominantly white and heterosexual. So moving on now to the different behaviours. The first element that we looked at was positive engagement activities, and these are interactive activities between the father and the child. And this can include things like reading, arts and craft, and play. Overall, we found this was very beneficial for promoting child mental health. We found that these types of behaviours can reduce child externalising and internalising behaviours, and it can also reduce child behaviour difficulties. We found that positive engagement activities among fathers could also improve child pro-social behaviours, improve social confidence, emotional skills, and also child self-regulation. There was mixed results on the association between child-father play, predominantly rough and tumble play, and aggression. The second element that we looked at was warmth and responsiveness. So this includes acting in a positive and warm way, an affectionate way towards the child, and can include things like physical affection and telling the child that they're loved. Generally, this is also very beneficial for child mental health. Warmth and responsiveness was found to improve pro-social behaviours in children and development in infants. There was mixed results on whether warmth and responsiveness could improve child internalising and externalising behaviours. And this is because there was a mix of studies which found there might improve these factors, or there was no association between them. The third element that we looked at was control. And this includes things like paternal monitoring, involvement in discipline, and knowing the whereabouts of the child. So with these studies, they looked at what kind of control behaviours were associated with different mental health outcomes. So we found that generally non-physical, not overly intrusive, and consistent control, or discipline, was associated with benefits for child mental health. And this includes things like improving pro-social behaviours and also decreasing externalising behaviours and anxiety in children. On the other hand, the studies reported that physical or harsh control, such as smacking or yelling, generally had negative impacts on child mental health. This includes increases in internalising and externalising behaviours in children and emotional difficulties, and decreases in child pro-social behaviours. So these are the last two elements that we looked at, indirect care and process responsibility. And these are whether the physical and mental activities done for the child. And generally we found this was a large gap in the research. There was only 3 studies that looked at these 2 elements, and their findings are largely conclusive due to the large gap in this area. So indirect caregiving includes activities such as purchasing and arranging goods for the child, or booking services like a doctor's appointment. Only one study examined, 2 studies examined this element, and one found that it may reduce depressive symptoms. The last element that we looked at was process responsibility, and this refers to the mental work done to manage the child's life and well-being to ensure that their needs are being met. I sometimes think of that this is the mental burden that people speak about in childcare. There was one study that looked at this, and it did not find an association with this type of behaviour in fathers and child mental health. However, there obviously needs to be a lot more research in this space to understand how these behaviours in fathers can impact child mental health. So as I mentioned before, our resources are aimed at practitioners in the child and family spaces. So our second aim for this review is thinking about what can this evidence tell us about how practitioners help fathers to support child mental health. So the insights I'm going to share here come both from the research and also from the consultations that we conducted with experts in the area. So practitioners can speak to fathers about the benefits of them being involved with their children. As previous presenters have already spoken about today, something that's great to do is just ask fathers how they're going with their fathering, what kind of behaviours are they involved in. One of the fathers who I spoke to who was sharing us some experiences he had in the perinatal period, and we asked him what's something you'd like for practitioners to know or do, and he said just ask me how I'm going. Which is quite simple and nice, but also kind of shows what fathers really need, just having a conversation. It's also important, as Vin pointed out as well, to take a strengths-based approach to these conversations, pointing out things that fathers are already doing really well and encouraging them to continue to do these things and to build on them. There is some evidence that taking a deficit-based approach can actually lead to feelings of shame or guilt and might lead some fathers to disengage from the service. Practitioners can also encourage fathers to engage in more of their behaviours that can support child mental health, such as interactive activities like play, reading, arts and crafts, and being warm and loving towards their children. As some of the other speakers have touched on today, it's important to be really intentional with how we engage fathers, because we know fathers are less likely to be involved in child family services than mothers. And doing simple things like using the F word and making it really clear that fathers are welcome and we want them to attend our programs can go really far. We can also think about whether there are any policies or practices in our programs or services that make the assumption that the mother is the primary caregiver, and whether there's any things we can do to change this assumption. I do just want to touch on some of the limitations of our review. So we really focused on contemporary evidence that's conducted in Australia or countries that are generalisable to Australia. So this means we aren't able to capture all of the evidence that's out there on fathers and child mental health. Some notable exceptions are we didn't look at any grey lit, and we also didn't look at any research from low and middle income countries. So as I mentioned previously, much of the fathers who were included in our studies were white and heterosexual, and this could be a key area for future research, where they could consider a more diverse range of fathers, such as queer fathers and fathers from varying racial and ethnic groups. Also, many of the studies that we looked at each type of father behaviour in isolation. And while this is really good when we're doing research, we want to look at how does this particular behaviour influence this particular outcome, looking at different combinations of behaviours and how they influence each other and child mental health could paint a better and more accurate picture of the reality of parenting and fathering. So very quick summary before I wrap up. We conducted a literature review where we looked at academic research articles and also consulted with some key stakeholders. We focused on studies that looked at the association between fathering behaviours and child mental health. And we found that many of these fathering behaviours were associated with improvements in child mental wellbeing and decreases in child mental health challenges. Some examples of these behaviours were interactive activities like play, reading, arts and crafts, being warm and physically affectionate towards a child, and practising non-physical and consistent discipline. Practitioners and services in child and family space can speak with fathers about their parenting behaviours, encourage these behaviours in fathers, and can consider how they can make their services and programs more inclusive of all parents, including fathers.
Well, welcome back, everyone, as we start to see some of our fellow panelists come back and join us online for this live Q&A session. I want to thank you again for joining us once more. I can see many of you trickling back in for this Q&A session. Hope you enjoyed that broadcast. It reminded me of the great energy and enthusiasm we had on the day. I continue to see some of those come through the questions that we have for you this afternoon. So please keep firing those questions come through. Did want to just briefly acknowledge too that some of the questions that we had came through were around some of those issues that we spoke about earlier around men's use of violence, men's experiences with the family system. We're not trying to shy away from those. In fact, we're with you. We agree they're very important issues. We did want to just make sure that we don't pigeonhole them into a brief, couple of minute discussion. As I say, we want to return to those issues in due course and give them the proper room that they need for discussion. So with that, I want to throw over to our panelists now for a few of the questions that have come through. I guess as one loosener, we'll start up with, and I'll throw this to all of our panelists. It's just around a very generic question around how, in our panelists' perspective, they think practitioners who work with fathers can best support the health and well-being of their children. So who wants to tackle that one to start with? Or I'll start nominating people. Vincent, you're first person on my screen. Do you want to shoot to that one?
Yeah, sure, thank you. And but before I do that, I do see a question from the audience about my slides not matching the presentation. I think I've accidentally given people my second presentation from the ACE conference, not this one. So forgive me, and I'll get that corrected before this webinar goes out and the recording.
Very generous of you to share more of your work, Vin.
Yeah, I wanted people to get the other presentations on. No, not really. Look, Sean, your question is a really timely and a relevant one, and I think for me, you know, perhaps a more generic answer, though one that I think is still important, is actually for practitioners to actually set aside the time to ask fathers how they would like to receive support, information, help. It seems like a little bit of an oversight, but it is one that we as healthcare professionals can sometimes be quite guilty of or fall into those patterns. You know, we might do things the same way that we were trained or the same way that we used to do things, and all of a sudden it's been, you know, 4, 5, 10 years, and you actually really haven't had a chance to ask the people you're working with, you know, is this right for you? Is this the right fit? Is this something that works for you? When it comes to, I think maybe some more specific recommendations, what we've seen here in Western Australia is I think more of a concentrated effort for healthcare professionals to maybe meet fathers where they're at. So this doesn't just include where they're at sort of in terms of their health and well-being and their life journey, but I'm talking about maybe even geographically as well. So if we were to you know, try and deliver intervention or resources or support for fathers, we're seeing growth in the demand for workplace programs. So we can actually deliver something in a palatable kind of short, brief format that might be appropriate for a lunch break, or kind of like a lunch and learn thing where the practitioners will actually come to a workplace and work with people there, rather than imposing these additional constraints, such as, if you would like support, that's great, but you need to finish work early, and you got to get in the car, and you got to drive for 30 minutes, and you're unable to, participate in after work activities that might include your kids. So I think going to where the parents are is really, where fathers are, is really important.
Yeah, great point. And I'm going to throw to the rest of the panel in just a second. Harley, that's another series of questions we got was around how practitioners can best support First Nation fathers, First Nation families. Do you have any thoughts on that?
Yeah, so I was thinking, with me being a father, I'm having to reach out. Also working, with families and stuff. Welcoming, you got to be welcoming. I reckon me walking into a room, seeing like Aboriginal art, or could be even like acknowledgement plaques to First Nation people acknowledging, like shows me that the organisation like generally cares a little bit, and also, my biggest thing would have been, you got to be open-minded. Like, everyone's different, and working with First Nations people. We've got over 500 different clan groups that make up Australia, and we're very different. So, people think that one sort of size fits all, but everyone's different, and you got to just, build a rapport, take it slowly. And I believe, we've got to give them a voice and, actually listen. And, sometimes that, that's something that I had to find out, I guess, because I'm narrative trained, and that made me a better listener, and because just because something's not your way doesn't mean that it's wrong. So I guess, yeah, take it slowly, build that rapport, and just get them to be a part, make them feel that they're wanted and needed.
Sure. Well, some great points, and thanks for sharing. I'll throw the other panelists. Are there any other thoughts on that particular question on how practitioners can best support fathers?
After you, Melissa.
Thanks, Tim. I have some things I think relate to maybe what Vin was saying, but first I want to say, like, fantastic answer, Harley. I think all of those things are so important, both in terms of First Nations fathers and also all fathers having imagery that's welcoming and language that's welcoming. So with some of our work we've done speaking to practitioners and fathers, something that's come up a lot that I think Vin touched on is recognizing that every family is different, and not the same thing's not going to work for every family, and recognizing the different family dynamics and family structures that may be present, and recognizing that both mothers and fathers are the experts in their own family and with their own children as well. And we were speaking to a father who was sharing their experience about being in the perinatal period, and something that struck me about what he said was, just ask me how I'm going. Like, something so simple was something that he didn't experience when he was engaging with services, and he felt that he really needed just to kind of be seen and have his experience as a father, and also, as someone supporting their partner, be seen and be validated. So I think it's just really important to have a really open and curious response when working with families and fathers, and ask questions, ask them how they're going, what's their experience of being a father like, how do they go transitioning to fatherhood, and try to have a very strengths-based approach in the response of focusing on what are they already doing well and how can that be built on.
Right. Thanks, Mel. And Tim, I'm going to throw to you just a second, but it did remind me, Mel, as you were speaking, to direct people towards those related resources in the handouts that you have put together. They touch on a lot of those issues, and I'm sure will be useful to a lot of people. Sorry, over to you, Tim.
That's cool. Two very simple things, I think.
Now we're back.
You can't hear me.
I know the audio's just a bit out of sync, Tim.
Okay. Look, the two important things, one general, one very specific. If men read or hear parent, they think mum. So including dads in the language that is used is important. And the other thing is they might be dads, but they're also individuals, like we've just heard from Melissa and Harley. It's wonderful if you can use people's names. Referring to somebody by their role is isolating.
Yeah, no, important point. And we hear again and again the power of language, not just with fathers, but in men of all different persuasions. So that's wonderful. I'd like to encourage our audience to keep those questions coming in. We're getting a lot of great questions. Tim, I might just stick with you if I can, because there was one question that came up around through your talk around education programs. And particularly education programs focused on relationships and men and relationships. Are you aware of any that exist, be it in the antenatal period or even beforehand? And are they something that we should be looking at for father engagement after the birth of their children?
Sean, as you know, I'm an evidence-based information kind of guy, and there is not good evidence about what sorts of education provision, format, content, what works and what doesn't. So the short answer is we don't really know. There are a number of very useful, it seems, anecdotally at least, fatherhood educational programs. One that I think of straight away is the National Fatherhood Initiative out of the United States. And that's evidence-backed. That's the only one of those that I know about. But there's a lot of support for fathers from particular organisations that deal with different aspects of parenting. So Panda has good resources for men, for example, perinatal anxiety and depression. The people who work on helping parents through perinatal loss also provide great resources for males. It's a matter of going out and looking for them, really. I don't know that there's one consolidated spot for them all. Perhaps that's a job for me.
Yeah, no, great. Gives us something to aspire to as a field, and just to acknowledge too that it's really great to see, particularly online, there is an emergence of new resources that are particularly targeted at fathers. So that's great to see as the field starts to develop. There's a very interesting question that came through from one of our audience members here that acknowledges the excellent work of many trying to create more male-friendly services, but also acknowledges that the majority of service providers in the family services and the counselling spaces are often still women rather than men. So a question to the general panel. Are you aware of any work that's been done on a capacity building front to build up that workforce to get more men involved directly working with other men? I'll throw that one open again to see if we have any bidders with our panelists.
But something I should have said earlier too is in saying that we have, you know, like we got our men's business, our women's business, you know. So some men might not be allowed to talk to a female, you know, in that setting. So that's something that I should have mentioned before. So definitely have to be, you know, take that into consideration while working with our First Nation families and stuff.
Yeah, definitely. It's a great point, Harley. I mean, we're just, as we're progressing as a field to create more resources for dads, start very broadly, and then, you know, it's a great sign that as the field progresses, we'll figure out how to work with dads of all persuasions, including First Nation dads.
Sorry, Sean, I was wondering if I could just ask Harley a question. I think you've touched on a really interesting point there, Harley, and I was wondering, from your perspective as a First Nations man and a father, do you have any recommendations for practitioners or services who are wanting to work with First Nations people, and, you know, how to navigate what's appropriate to speak to, like, men to men and for men's business, and what's appropriate for women to women for women's business?
I think you just, everyone's sort of different. You just got to ask them questions. First of all, you know, I'll utilise your Aboriginal workers in your workforce and your organisations, get them involved, and then pretty much, you know, you just got to ask them questions, just so you're not sort of treading on toes and that sort of stuff. But yeah, just be open and honest. You know, because yeah, you don't know until you ask.
Fantastic, thanks, Harley.
And Vincent, can I ask you as thank you, as a practitioner, right? Are you aware of any workforce capability work?
Yeah, it's a great question, and I think that there's probably two pieces to this, right? The first is in that question from the audience member, the first is, what is the existing workforce able to access or receive or take part in that might be able to help them work better with men more effectively or with fathers more effectively? Probably the example that comes to mind that I'd be remiss without mentioning is, for me, from a mental health background, Movember have done a really good job at putting together a program called Men in Mind. It's an online resource. It's kind of like a PD, professional development type of course that people can use. It's obviously designed for people working in the mental health space, but some work that I've got going on the back end is making me query whether or not that actually has utility outside of the mental health space and more into kind of antenatal, perinatal care as well. But really what this program aims to do is increase a mental health care professional's skills and confidence to connect and respond to the needs of male clients and the typical types of expressions of mental health distress that are common for men. So there are resources and there are materials that are out there, and I dare say internationally there may be some other ones as well. I'm just thinking about what's available domestically, and Movember have put together something that is very highly polished, but also has the evidence base to back that up as well. So when it comes to study designs, evaluations, Men in Mind has been quite robustly evaluated. So that's why I'm a big advocate for a program like that. The second piece to the question that was asked was almost like increasing the number of men, male practitioners in the workforce as well. And I think that's maybe, I guess, a slightly more challenging problem for us as healthcare professionals and as academics, because really what we're talking about is making these courses maybe more appealing or incentivizing for male practitioners, and that can sometimes be challenging. We know that there are certain professions still where there's quite pronounced gender differences between men and women in terms of people going out of into tertiary education. And that said, you know, I do think of some stories, particularly in some of the work that I've done in neonatal intensive care units, where at a birthing hospital here in Western Australia, I think out of I believe it was maybe 300 nursing staff, there was one male nurse who was working as a midwife in the neonatal intensive care unit. And the story was this guy couldn't walk down a hallway without a flock of dads kind of chasing him and asking him questions, because they wanted to have a conversation with another man about this experience. You know, am I going to be okay? Is my baby going to be okay? Is my wife, my partner going to be okay? And it's really interesting for me, because obviously the male nurse never signed up to become the advocate for all male nurses or anything like that, but he really took it in his stride. But the other thing that I'd probably encourage people to do, and I think this is really important, and I think Mel mentioned it earlier on as well, is there are a group of men in the community who will be highly resistant to getting support from someone else that they don't perceive as being able to understand what it's like to be on the journey that they've been on. And often that line that they draw is along gender lines. So it could be, you're a woman, I'm a man, you don't know what it's like to be a man, so I don't want to talk to you, or you're not going to be able to help me. And I think that for us as professionals, we could interpret that as let's put them in the too hard basket, let's refer them on, let's not bother providing them with the support. But maybe a more optimistic way to perceive this is this could possibly be a bit of a clinical challenge for us. And it could be one that we can use to our advantage, right? And I think about that for me as a mental health care professional. If I'm working with a client who's a man, I still might know I still might not know what it's like to be them in their experience and in their journey. Just because I'm a man and they're a man doesn't necessarily guarantee that we're going to be able to speak the same language or understand fully understand what it's like to be in that situation. So I think that for people who find themselves working with men who may not identify in the same way that the client presenting is, I think that there are there's a way to build that relationship. And I think, again, for me, the way that I've found that's worked is kind of taking this curious stance. You know, I kind of don't really know anything about your experience. Please tell me, educate me, show me what it's like to be you in this situation. I'm not a man, or maybe I'm not a father with a child with complex needs. Tell me what that's like. And so what you find is that as long as you're open to being able to attempt to understand what that person is going through, very quickly do those lines tend to dissipate, and you can actually build really productive, meaningful relationships with clients who you actually thought you may never have actually been able to build that relationship with. It's just about giving them the space and for them to be able to see you actually taking the steps to say, what's it like to be you?
Right. Well, thank you for that, Vincent. Just a very quick follow-up, if I can, because it's one of the questions that also came from our audience. I mean, does it actually matter whether fathers have a male practitioner or a female practitioner? Is anyone aware of research that does suggest there's a clear preference for one or the other, or the preference is really just for a targeted service?
Don't specifically know about the perinatal context, Sean, but
yep.
In primary care, the gender of patients, the gender of the carers of males does not matter in terms of the quality of service they receive, quality of care.
That's my experience too, as you say, within primary care. I mean, Vincent, you're often delving into the research on these matters as it relates to sort of fathering services and provision. Is there a gender preferences for dads, or there is, as Tim suggests, more just a concentration on proficiency?
Yeah, I think the priority really is proficiency. I think where you might see some of a resistance is, again, it could just be that entry point. I think that there might be a group of people in the community who we may, as professionals, may never see, because they go, you know, like I really want to chat to another father or a man who's maybe further along in their parenting journey than me. Knowing that this service doesn't have anybody like that, I might not actually go there. So it's important for us to recognize that there might be a group in the community who we might not ever see presenting clinically. But I also think that if we can work to maybe overcome that entry point, and I think some of the ways that we can do that is, you might find that there are people who might work as less of a clinician and more of like an advocate for a particular service. Again, talking about the proficiency in that service, but at the same time as well, when we're thinking about proficiencies, I really do think that it's any proficient healthcare professional can build meaningful relationships with their clients, with fathers, irrespective of where they are in their journey. Because the other thing that I probably do caution people against as well is that if you're a clinician and you've got kids, what you don't want to be doing is, if a client comes in and you say, well, this is what I did for my kids and it worked, so just go and do that with your kids, right? It's a really quick way to put them offside, because you'll get things like, well, you don't have the same kids as my kids are different. They've got different needs, different experiences. Our family is different. And so it's sometimes really important for us as professionals to spend a lot of time actually listening and building the story for these people to ensure that they're feeling heard and that we understand their story. It's not my job to impose what I did as a parent onto you.
Just what you're saying there. Oh, sorry, Harley, you go.
So I think location is a big thing too, because I think it's very different to, say, remote communities to working in the big cities, you know. So I think every sort of, you know, plays a factor. And I know that, you know, I believe that we need to bring the sort of two worlds together a bit, because we're not, you know, all academic with PhDs and degrees and stuff like that, but lived experience, bringing that alongside, working together, get better outcomes, I guess, you know. I know for community and stuff too.
That's a great point, Harley. And it's a beautiful segue into one of the questions that's just come through, which is around whether or not collectively we're aware of online programs that are specifically for fathers in regional or rural or remote locations. Again, Harley, if you are aware of any, or generally in the panel, if they could point us in the direction of some of those services.
Me personally, working with First Nations, like it depends where you live and your community. You know, I suggest, you know, because there's different programs and that running out. I guess go to your local. You could go to your local Aboriginal community controlled health services and that sort of stuff, and find out what sort of programs are running in the community, and I guess sort of just get amongst it that way. Ask them questions and go into, you know, Aboriginal organisations and just make them connections, I guess.
It's a great point. On the rural, remote or regional, anyone else on the panel got some suggestions for our audience?
I had the resource on my desk, and when I cleaned it to make my office look clean for this presentation, I've relocated it. But I was at the Men's Health Symposium in WA last year, and we had an organisation whose name is out of my mind at the moment, but they gave us a you know, like, I don't know about the eastern states, but here, you know, you get those things in your letterbox, which are like almost like a little mini community guide with all the local organizations that you can call and access. And they had those printed, but for rural and remote men's health initiatives. So this wasn't just fathers, although fathers stuff was included in there. But there was a range of sort of men's health services as well. This included things like mental health, but also physical health. And so I can try and find that, but I know those resources do exist. And then the other thing that I've seen again here in Western Australia is there is some kind of like community-driven grassroots types of communities that are popping up for rural and remote dads. The one that comes to mind has been around, I think, for a couple of years now. That was started by a guy up in Karratha, which is kind of, you know, on the top end of Western Australia, who recognised that you know, West Australian dads living rural and remote, or who might be working fly in, fly out, might have unique experiences. And so he kind of brought this online community together, which wasn't, it's not a program or it's not an intervention or anything like that. It is kind of more of like almost like a digital men's shed type of, or like, you know, that council of dads that you can go to and discuss. And I think that, you know, a lot of fathers may find themselves inadvertently participating in these types of communities, right? Like it might not be a dad's group or a rural and remote dad's group, but you might be part of a local organization. It could be a football club, it could be a religious organization, or it could be even built around the kids' school, where there are these opportunities to get together and talk to and share with other fathers. So I think those types of grassroots community-oriented organizations, they fill a gap in the community that I just think a professional health service will never be able to do, because these are your neighbors, these are your friends, these are your peers. And I think that that's just as important, perhaps, you know, I say it half tongue in cheek, but perhaps more important than these professional health services that you might have infrequent contact with across your life. But these you know, the people who are around you and the fathers who are around you in that community that you may find yourself, connecting with at schools or at the workplace as well. I know, for example, the Fathering Project have a working fathers program that they're rolling out at the minute, and that's actually providing a space where you've got all these men who are working in this organization who may have never really talked about their kids together, or really never talked about fathering together. They've always been talking about work, and they've created this space where actually, oh, you know, your kids go to a similar school, or they play for a similar football club, or whatever it is, and you build these connections and these communities inside existing communities that you're a part of.
Yeah, look, it's a great point. Yeah, Tim, I'll throw it over to you for 20 seconds, mate.
It's a really quick one. SMS Dads, of course, is a great resource and is not geographically locked.
No, it's a great point. I wanted to follow on from Vincent, just to acknowledge, as we saw in the symposium that we had before, there's a great groundswell in the community. There's a lot of energy that seems to be filtering up to us as researchers who are working with groups like Vincent Fathering Project, Support for Fathers, the amazing work that gets done with the Australian Fatherhood Research Consortium. There's too many to mention. Now that I've mentioned, I know I've absolutely forgotten too many, but they are all starting to pick up that energy, turning it into, as you said before, Tim, some evidence-based programs, which then hopefully creates this virtuous cycle that ultimately means for practitioners, for service providers, what they're able to provide to men to come to them will ultimately be effective and worthwhile men who sometimes find it hard to reach out for help. All right, unfortunately, it is my solemn duty to just say that that is the end of today's session. I really want to particularly thank our presenters who have joined us today, who have showed us that sometimes the sequel can be as good as the original movie. Thank you all for your time again today. I particularly want to again thank our audience members who have just been wonderful, energetic. I apologise, I've been trying to desperately monitor some of these questions. We weren't able to get to all of them, but we will hopefully do so again in the future. Just a quick shout out to our team, our behind the scenes team, Pragya, Aaron, who's kept us all on our toes, and particularly our colleague who's joined us today, Mel, has done the cat herding, brought us all together, and frankly done most of the work. I'm going to thank you all for your work today. I just want to finish with a reminder about the feedback survey that will be sent to you all after this. Also a quick plug for the AIFs newsletter. Please subscribe to that, like and subscribe, and you'll be notified about this webinar and other amazing bits of evidence that come around all manner of family well-being. So with that, we'll draw things to a close. We look forward to catching you at our next webinar, but until then, take care, happy Father's Day, and we'll see you all again soon. Bye for now.
Thanks, everyone.
Thank you very much.